lovely audience. This is Marcella again, co-founder of Dental Tourism Albania. I have the pleasure today to be on site Dental Med Austria, one of the top clinics and most modern clinics in Albania, in presence with the technical director and CEO, Dr. Mentor Zeqja.
Hello, thank you for visiting me.
It's a beautiful clinic. I felt like I walked into a five-star hotel. It's amazing.
Thank you. We try to do something very modern and advanced because this is a long journey that we done, and I think we tried always to be on the top, and this was our goal, to do something very special, qualified for the European Union standards, but not only. And yes, I think we are now at this moment, at this point that we tried for several years to be and to do. We are a modern clinic which offers very specific treatments here, which we will going to talk later on. But we have high standards for our patients, which are for different social stages and levels. So here used to come people from any kind of Albanian or European level, so workers or the entrepreneurs.
Everybody is welcomed.
Yes, because we welcome them anytime. Just they have to do their decision to give us trust and faith, and once they decided to be here, we host them and we give all our intention to do the best of what they deserve. There are many people that has several years suffered from different gum diseases or other problems, and yes, after we check the situation, we finalize then a protocol, and then after we give them a quote, which can be different from one patient to other because yes, and then we welcome them to work with us and work with us. It is like a journey because some people finish it in 10 days, but maybe some people need to finish in 2 steps, in 2 phases. The first phase will get some days, like 5 days, and the second phase after 4 to 6 months, they come back again to finish the work. This is a special case when they do implants, and now in this case they have to be 2 times here.
Travel a couple of times.
Travel a couple of times, yes.
Dr. Mentor, it certainly has a wow factor. So I cannot foresee any patients walking through Dental Med Austria door and wanting to leave. I feel like I'm in a high-tech dental environment. I see so many different smaller clinics, so it feels like you've actually done so many clinics and incorporated them within the same space. How is the work divided? Do you have different specialists or different areas?
Correct. We thought to bring like a small specialized clinics in one altogether place. So we done here now a one-stop shop clinic. It's a day hospital, but not only. And we do this in a different places. We have like orthodontics treatment. We go to endodontic treatments. We do then the prosthetic treatments in some other clinics that we mentioned, Clinic 1, Clinic 2, Clinic 3, as so on. Then we have 3 surgery rooms equipped with the highest tech that exists. So not in the European level only, I think world level we use this is global level. And we then have the prosthetic, as I mentioned. We do here veneers, we do crowns, and rarely bridges because we are against the bridges. We try to yes, but today on everybody that has bridges want to remove that, and instead of bridges we do then implants inside, and then 4 months later we finish this and we do the dent, the tooth over the implant, and then it's the work done. Right? So this is what we thought at the beginning, and through this long journey from Dental Med Austria, we have now a newcomer to the clinic, which is the Alexens clinic.
Yes,
It is
Alexens
by yes, it is Alexens by Dental Med Austria. So this is another one-stop shop part of this, because we do this longevity, anti-aging, healthcare. We do stem cells, and of course, the last but not the least, the most important service that we do here, it is the EBU, extra blood corporal oxygenation and ozonization for the blood. This is a technique, this is something very modern and new in the biohacking technology, regenerative medicine. There is, I mean, some places in US, like New York, and a friend of mine has one of these in Miami. This is another one in Dubai. Albania offers this exclusively, maybe for the Europe, the first time that we are bringing this here.
It's a massive achievement.
Yes, but it was time to do that because we see it in a very large scale, the health treatment. I mean, not only teeth, which is part of our health, very important for everybody, but
we all have them.
Yes, but also this regenerative medicine that we are offering here, and we have specialists from all over the world that are coming to assist and to give us their experience. And yes, we have Italian doctors that are doing this.
You have international doctors?
Yes, and we are now international.
Okay.
We speak many languages here.
Which ones? I know English, Italian.
Most, I mean, like
Albanian, of course.
Like 6 languages
Okay.
are spoken here, like French, Italian, Spanish, Russian, German, English, and Albanian, and Arab, because we have girls from Tunis working for us, which are native French speakers. They speak fluently English too, but they speak Arab. So we have people from the Gulf coming from Dubai or Abu Dhabi or Oman, and they get the services by us. So some of them want to speak English, some of them cannot speak English. But yes, we offer assistance on it.
No one should feel that they will not be able to communicate.
No way.
I know you also told me off camera that if there is a specific patient that needs help, you will find someone who speaks that language.
Yes, of course.
And support them. So
yes, of course.
It should never be someone's fear, because traveling abroad for dental treatments, the first thing in your mind is, will they know what I'm saying? Will I know what they're saying?
Correct.
Are we going to lose things in translation? So I think this is very reassuring.
Correct.
For anyone.
Maybe if once we begin to work with Portugal, which is the next our favorite place that we're going to get patients to come here, we will need a Portuguese speaker here. And
anyone looking for a job that speaks Portuguese?
And I was talking to my assistant, and he said, yes, we have 3 requested for patient coordinator here that speaks Portuguese. So I think we are in a good way. Even if we want to reach this market, we have people that speaks
you can
Portuguese.
Accommodate everyone.
Yes, of course.
Great, amazing. Dr. Mentor, I'm going to be very honest. I came in with a prepared list of questions of what I wanted to ask from you, and I'm overwhelmed with everything that I'm seeing. What you have achieved here is anyone who struggle with their self-esteem because they don't have the best looking teeth, or they want to get other treatment in rejuvenating and feeling better. So you just walk through the door and you walk out a different person.
Correct.
That's amazing.
Correct.
And I really love it that you have brought something so new to Albania and to Europe, and it's brilliant. Really,
Yes.
really happy. Well done.
We saw in the future, in the past, and we will see in the future always people that are suffering from surface estimating, you know, because somebody has this kind of problem and somebody suffer on another problem, and we are going, and now I'm announcing this for the first time, we are in the next 4 months maybe finishing our other hospital, which is very close here. It's not in the same building, but it's we go underground with the buggy and we go to connect it, and we're going to do a surgery, plastic surgery hospital for everything in the beauty. So it then will be completed, that we will care for everything that the patient may need, we find here. If somebody comes to do the teeth, the wife can accompany him and do some other beauty treatments here.
Just get full of ideas here. You just want to do everything, right?
Yes, because everybody needs something, especially in those days that we're living. Mostly of people look after.
We are aware now. We know that we want to look better, and
Yes.
we know that we want to
And
feel better.
better, yes. And
now
be
we
healthy.
acknowledge that.
And be healthy. Finally, people understand how they will what they eat and what they consume, and I know that and what we are exactly. So I see here a very potential place to have all this treatment done in a place.
Dr. Mentor, I have a personal question.
Yes.
All that you have achieved is not by chance. I'm sure it's come with a lot of sweat and tears and hard work. Talk to me about your journey. How did you decide to become a dentist? Where did this vision come from?
I was not. It was not planned from my side that I'm going to be a dentist. But my parents and some other circumstances brought this, and then we began to study, and then after we finished it, and then we decided to open the first clinic, which was very small one. It was just me and my wife and another 2 assistants, and we got just 1 chair at this time. Yeah, this is years ago, and there began the journey, and we treated well with confidence, and we treated with very professionality the patients. And then we grew up. The word spread that we are good. People were coming to us, and then came the necessity to open a second, to make a second chair, and to enlarge the clinic. And we go to 3rd chair and 5th chair, and the requests were and demanding were
And this is
high.
all by patient referral, because we're talking about a time when social media wasn't a big thing.
No, it was not a social media even. It was just word of mouth.
Good work.
And good work, yes. The people was bringing another one and saying, I need a treatment here, I know a place to go there because they're good. And yes, so we arrived in the level that we had done 6 chairs in the clinic. So then we decided to go bigger. So and then we grow, and we have 16 chairs here and 6 chairs there. So we have 22 chairs altogether. So we have a high capacity on producing and finishing patients. So it is not a queue here that a patient comes and has to wait 3 hours to come to the dentist, but everything is well organized at the moment they come here. We know exactly where he has to go, in which clinic he has to take the treatment. The dental assistant accompany them to the place and explain him or her everything what's going to happen. Then the doctors are coming and they explain also what they're going to do with the patient before and during the treatments.
The patient is always aware.
And the patient is aware what's going. We clarify everything at first. What the products do we use? Because the patient has the right and deserve to have the right to know what we are going to put on his mouth. And
Before we dwell a little bit more in this, what I have really appreciated is that even with a massive, rapid expansion of your clinics from one to the other, both yourself and your wife, Dr. Albania, which I've had the pleasure to meet, are so involved with the patients. So just because the clinic has expanded, you two haven't disappeared and just have other people do the job. I can see you are,
I'll never do that.
you're trying to meet as many patients
Yes.
as possible, and
Yes.
Dr. Albania as well, and they can see you, and whoever comes here, you're always present.
This is something very, very specific and very important for this, because all the patients are coming. I think even if I am not doing the procedures, they look at me as a guarantee or something like this. And yes, even if I cannot work in 16 chairs in the same moment because there's a huge staff here working, but everything that goes out from here and enter to the laboratory, we are checking, I'm checking, and my wife too, and the other staff that is surveying this. And this is the reason why I can't get the hands off of this, because I love this job, I love the patients, I love what we are going to treat and to do. And yes, I cannot take I cannot go even on vacation a long time, because the patient keep calling, doctor, I'm here, I want to speak with you. I said, yes, is there another doctor? Yes, but I want to hear this from you. And this is something is good, is bad at the same time, because I never can get away from the clinic,
But I can only imagine that you probably cannot get enough of faces coming in with insecure faces, scared, what's going to happen to me, and then that wow factor at the end when they've had that full transformation, and I cannot imagine you get enough of that.
This is the most exciting part of this job, when you see people coming not with the self-confidence, scared, and after treatment, this is the moment when we see how do they look like and how do they embrace us. And yes, this is the satisfaction, this is energy, what I get back from all this hard work that we are doing daily here.
And I know you're also very devoted to your job, and the room where we sat now also acts as a training and PhD and other researches. I kind of overheard something earlier when you were saying, can you enlighten me? What was that?
I mean, yes, we got from European Union the certificate being University Clinic of Excellence. I don't know how, yes.
Said just like that.
Yes, and here going to be held then from all countries in Europe, the PhD and the MD, and many doctors are going to, the young doctors are going to come here, and we will, train, and then we do this training here, and we do everything, but our technology is allowed to give them back all these knowledges that we already have in this field,
Sounds very exciting.
Yes, it's very exciting. So those are the things that make us happy.
It's fantastic. Really happy. I overheard that because I think everyone should know.
I really appreciate this from the European Union that gave us this certificate, trust, and they've been looking around the area. They've been in Croatia, they've been in Hungary, and been in Bulgaria, I think. And then when they stopped here and see all what we're doing, and they get back the some more information, and then they look at the practice that we're doing. So then they decided, so this is the clinic, and this clinic is going to be part of this. With us altogether, 4 clinics in Europe.
Oh wow!
Yes, we are the 4th.
Even a bigger achievement, so your achievements keep topping up.
Yes, but we're not stopped here. We got now from Forbes, I think at the end of September, I got now the interview for them.
Oh wow!
Which I'm very happy and very glad that they choose
again. That's at the end of September.
It comes out in the Forbes magazine in the end of September.
I'm going to beat that. I'm going to share this interview before Forbes.
Yes.
So Dental Tourism Albania will come
yes,
first.
that'd be great. Yeah, lovely. Yes. Okay.
Thank you so much for this journey. I couldn't, again, as I said, I couldn't stop myself by peeking around and all the high techs. Can you tell me a bit more about what kind of equipment and scanners, and you told me, what does the clinic use?
The clinic use always the top and the latest generation of a CT scan. We have a Tirana 2025. I mean, it is just now produced with the highest technique and technology.
Very new.
We have a ray face here, which is a very new tool in the market.
What does
This you can do if you want to do aesthetic one.
Okay.
So veneers or something like this. This make a panoramic of 360 degree around you, and this is going to be transmitted from this device, from this scanner to the laboratory. Is connected, and the laboratory, the girls there prepare how you look like after the treatment.
Oh, wow.
So you will see.
Is the smile analyzer?
Yes, exactly.
I
That
love
goes
it.
around.
I love
They makes
it.
the arms like this, and they surround you, and then
I tried it.
I tried
It was fantastic.
Yes, that's good. That's
It
good.
really
Yeah.
intrigued me.
So then we have we work with the dragger in the surgery industry, and then we are here. I don't want to mention all this because I cannot remember, but
There's so many.
we work also in the materials field because this is the most important part. What maybe a patient want to hear from us. A patient want to know what we are going to put them on. So implants, we have German one, so Biodem, Düsseldorf. We have Implant Swiss from Switzerland. And then we have the top of the world, which is Straumann. And those three has different prices, but different categories of people are asking for something economic, standard, or exclusive premium, you know? So we offer all of them, so everybody can
To
find.
make sure everybody has an
Yes,
opportunity.
because
to
everybody deserves the right to get treated from us, you know? Even if you don't want to spend a lot of money, if you have a small portfolio, yes, you can do the treatment here. If you have something better than this portfolio, you can be a standard patient and you have something better. And if you are a high-end consumer and you want to have the top of the top, you can have it here.
Dr. Mentor,
So from A to Z, you can get it here.
I am Albanian, but I've lived in the UK for many years. I think over 25 years now, and I know for first-hand experience, patients who look to get international. At least I'm talking about friends and family that I know in the UK. Why we struggle to often make a decision about getting implants abroad is because when we go to our local dentists, and if we need help and support, they want to make sure that we have the right passport, certification, and it has to be recognized over there. Otherwise, we just don't get the help, and they'll ask us to go back to the original clinic. Now, sometimes it's possible because luckily Albania is very close to the UK. It's only like 2.5 hours away, so many direct flights. But if you had to do these dental treatments further away and you don't have the correct certifications, it puts you in a very bad position. So how does it work? Are these brands that are used internationally and recognized in maybe Western Europe in this case and global? So patients who are deciding to use any of the implants that you've mentioned shouldn't really have an issue if they needed further support in their home country.
Exactly. I mean, the implants that we're going to use are all CE certificated, and we don't use implants that are not recognized from European Union. As I mentioned, these implants, if somebody do the implants here, maybe at any time can get back up there in England. And in United Kingdom, sorry, because it is larger than England. And yes, those implants, those materials that we have are certificated, and we begin from the normal random tooth or root canal. We use products like Asteria or Estelite, which are the higher brands in the dentistry field, and if we work with for crowns, for example, or veneers, we use mostly Zircon, which is a high-level brand, and in the IMEX we have chosen to work with the best, which is the best and we stay the best. It goes Evoclar, and we use only them, and Evoclar is for us the best solution to do aesthetic treatment, which gives you the natural beauty.
The reason why we started Dental Tourism Albania, it actually started from a personal need. At a very young age, I needed crowns, or I don't know if I needed crowns, but that's what I ended up doing. And they're fantastic. It's been over 15 years, and I was told it's a guarantee of 5 years, and then you should kind of make sure that it is all working out for you well. And I've had them for over 15 years. They're fine, nothing happened. And this is done at a local dentist in a smaller city in Albania. But what I wish I had been told, so the job has been done to perfection, you know, I've never had an issue, but what I wish I had been told, Marcella, you're a young woman. You don't need a crown or a bridge, you just need an implant. All I had was a missing molar. So rather than being offered or suggested an alternative treatment, I'm like, oh, my mom got crowns, it worked well for her, can I get that too? Like, yeah, let's do it. So I love it how you mentioned earlier that any patient that will come here will go through all the different stages to make sure that the doctors have a very clear vision and will offer the patient different planned treatments according, you know, the need, so the patient can choose.
Yes, but we are clarifying also the patients of our point of view, what she needs. Yes,
the best treatment for them.
Because a patient is a profound, you know, he doesn't know this, and he comes here and all he relay to us what we are going to suggest, and we suggest always the most long-term treatment that is possible, and the best one is possible. And a bridge, as I mentioned, is not the best one. We are not going to touch 2 teeth to make a bridge, and we are going just only to put an implant there, and the teeth we don't touch. But okay, in the case that somebody has done, we do it again, we take off the bridge, we do an implant, and those 2 teeth, we liberate them and let them alone to take the weight, because when we bite 480 kilogram, and that has to be spread in over the forces. And if you have 2 teeth that take the weight of 3, always these 2 will be damaged. So that's the reason why it makes no sense for you today doing this kind of treatment. So maybe 15 years ago,
it was a different story.
It was a different story, and this small town guy maybe doesn't has the right idea to do that, or doesn't want to.
I'm sure now they do. It's been a long time.
Yes, I know.
Well, we also live in the era of information, so now patients come with ideas and requests, so they'll often say, look, this is what I think I want, this is what I think I need. And there are different trends that are going around that patients, especially in the younger age, that want, that aren't necessarily advertised correctly. So they kind of not get told that every treatment will, to a certain way, touch your tooth. There is not any treatment that will be, you know, completely untouchable. So patients will come in with certain requests, and I think it's a brilliant way for the doctor to notify them correctly so they make a more informed decision. And this is great, I guess it happens all the time.
Yes, actually, we give them the clearance about this, but sometimes the people have made already a decision.
Yeah.
And if we then step against, they will just walk away and go to another place and do that. So we think then, okay, in this case, at least we do this.
So
do it correctly, yes. Because we see if a young girl, 25 years old, want to do this, well, you can stop it, you know. But sometimes, yes, we change the suggest the correct way to because
as long as, you know, we're telling them that this is the right way and the wrong way, and that they're making a more informed decision, so at least they know how it will impact them in the future. Amazing. I have an idea.
Yeah.
So, as I mentioned earlier, given that I live and work in the UK, and I really want someone from the UK to test your clinic.
Oh yes, I would love this.
Can I ask for your permission to find a patient that really needs a transformation but cannot necessarily afford it, or for whatever reason the complexities were higher and were not suggested it? Can your clinic do this in collaboration with me and Dental Tourism Albania? Can we bring at least one patient to test this, but free of charge?
Yes.
I know it's a big ask, but...
Okay, I would love to do that, yes.
Yes?
I would like to do that. I will do this, really.
Thank you.
I will be very honored if I can do this and make somebody happy who cannot afford to have a beautiful smile and to have a good job done, and with implant and everything else. So yes, I will do that.
Oh, this made me shiver now. I'm so excited. I'm actually going to start a campaign and reach out and see if we can find a patient who would benefit from this treatment. Really, really appreciate this. A big gesture of goodwill. And perhaps, maybe in the future, you and your team can come to the UK, meet some patients face to face. I know you go travel the world, but
yes,
UK is in my heart because I live there.
I will love to do this too. Maybe I come personally there with my team, if you like. I take 2-3 other doctors with me, and we represent our clinic there, like idea like open day or something like this, and we are going to speak with the people to give them more information.
Free consultation.
Yes, it is a free consultation. Just we tell them what they have to do or how can do, or give them a guarantee for our treatment, how we would like to do this and how we do this. And yes, I mean, I would love to come to UK to do that, yeah.
As a token of appreciation, you let me have what I asked for. I'm going to help you when you are ready to do this in the UK.
Yes, I will need the support because I'm not a citizen that lives in the UK, so maybe you will support me for everything. I would do that. I will come there.
Let's get organizing. Let's get organizing. I'm very excited for this.
Yes, okay. And I always wanted to be to see UK, not London only, but other parts too. So like Ireland, very much. I'd love to go to visit Scotland, and I want to.
Christmas time is the best.
Yes.
Or Halloween. Yeah.
I mean, Christmas is better, I think, yeah, because it's a fest for everybody. So lovely. Take your invitation and accept it. And
amazing. Look, we have loads of plans. Better get going and start organizing.
Yes.
It was a pleasure to speak with you today, and I'm so sorry that I've kind of put you on the spot and with my questions and getting some promises. But I really love it how you were so supportive in this. And I think someone out there is about to get their smiles brightened up by Dental Med Austria and in support from Dental Tourism Albania. Very excited.
Yes, I would love to. Tirana is not so far away, and we have to offer not only the treatments here. I mean, the patient may see sightseeing places here and to taste our wonderful cuisine that we have, and it's a multi-cultural place here. So. You can get everything also with the treatment, dental treatment. So I think it's a good place to visit. Albania.
Big plans coming up.
Okay.
Stay tuned. Stay tuned. Wait for Tirana to tell you all where you can find us. See you soon.
Thank you everyone for joining us on today's podcast. Stay tuned for more and don't forget to follow us on our socials.